So in this video we will discuss regarding main important points to be remembered for the exam. This is part 2. So in this the important one is the largest salivary gland. So the largest salivary gland is the parotid. Parotid is the largest salivary gland. So the salivary glands are located in the mouth. Okay. So the next one is the glossitis. Glossitis. So glossitis is nothing but inflammation of tongue. So the next one is iron absorption. So iron absorption taking place mostly in the duodenum. So duodenum is a part of small intestine. So the next one is cooling sign. Okay, so this is very important thing. Cooling sign. So in which condition we will see cooling sign? That is pancreatitis. So in the case of pancreatitis and hemorrhagic mostly. So in the case of hemorrhagic pancreatitis we will see cooling sign. So the next one is the hematemesis. Hematemesis. So in the hematemesis is nothing but blood vomiting. Okay, when the person has vomiting, in the vomiting if we observe blood, it is known as the hematemesis. So the next important point is the portal vein pressure. Portal vein pressure. So what is the normal portal vein pressure? That is 5 to 10 mm of Hg. Okay, 5 to 10 mm of Hg, that is portal vein blood pressure. So the next one is the McBurney point. McBurney's point. So where we can find the McBurney's point? That is lower right that is right iliac region. Otherwise okay, so the right iliac region, otherwise it is known as a right iliac fossa. Okay, so this is the McBurney's point. Mainly we can see the pain in the appendicitis. So when the appendix is infected, it is known as a appendicitis. So the next one is the next important point is Crohn's disease. So what is the Crohn's disease? It is a intestine. It is involved in the large intestine. So the large intestine, it is all layer of the wall can occur anywhere GI tract from the mouth to anus. Mainly the condition of this Crohn's disease. So it is a inflammation of the bowel intestinal layer. Okay, mainly in the digestive tract. So this is a Crohn's disease. Crohn's disease is nothing but inflammation of the intestinal lining. The next point is the Hirschsprung disease. So what is the Hirschsprung disease? When the intestine is failed in the formation of egg ganglionic cells. So when there is no presence of egg ganglionic cells or in the intestine, it is known as a Hirschsprung disease. So in this condition, the child, this condition is coming by the birth. So it is congenital deformity. So in this condition, absence of egg ganglionic cells, it leads to the absence of intestinal movement. So in the absence of intestinal movement, what will happen? Obstruction of the stools will be taking place. So the next point is a Gray-Turner syndrome, Gray-Turner sign. So this sign we can see in the pancreatitis. So like a Coulin sign and Gray-Turner sign we will see in the pancreatitis. So in the Gray-Turner sign, we can observe the bluish discoloration over the side of the abdomen. So the next point is the volvulus. So what is volvulus? It is nothing but twisting of intestine. So twisting of intestine is nothing but volvulus. The next important point is a induced suspension. So what is induced suspension? It is nothing but telescoping of intestine. It is nothing but telescope of intestine. That is nothing but when the intestine is inwardly, it is going into the so the intestine will be, when it is enter into inside of the other part of the intestine, this is nothing but telescoping, otherwise induced suspension. So in this condition, mainly we can observe the jelly-like stools. So you may get the question, that is, jelly-like stools are seen in which condition? So you have to put the answer, that is induced suspension. So the next one is Kupffer cells. So where we can see the Kupffer cells? Mainly only in liver. So what is the function of Kupffer cells? Phagocytosis. So phagocytosis, the function of Kupffer cells. So these are present in the liver. So the next important thing is hepatitis. So hepatitis A, B, C, D and A. So what is the mode of transmission of hepatitis A? That is fecal-oral, and the last one is the fecal-oral, that is hepatitis E. So remaining three are transmitted by the blood and body fluids. So hepatitis A and hepatitis B transmit by the fecal-oral route. So B, C, D is transmitted by the blood and body fluids. So the next one is the epistaxis. So what is epistaxis? It is nothing but bleeding nose. So in which position you can advise a patient to sit? That is anterior flexion. Okay, so the patient has to lean forward. Okay, so like this. So then the patient has to squeeze the nose. Okay, squeeze the nose, otherwise you can apply cold application. So cold application you can advise for the patient, that is epistaxis, bleeding from the nose. So the patient has to sit on the anterior flexion, lean forward. So the next one is the burns. Okay, so in the burns we have the degree of burns. First one is the first degree of burns are mainly involve the superficial skin. Okay, so this is called superficial when the burns are occurred, that is first degree. And next one is the second degree. So in the second degree it will go deeper into the superficial, that is some thickness burn. So it involves the dermis. Okay, so in this we have the epidermis. So the involvement of the skin dermis is known as the second degree burns. So this burn is very painful. So you may get the question, that is very painful burns. So that is second degree burns. So the next one is the third degree. So in the third degree it is known as full thickness. So full thickness burns. So in this epidermis and dermis and subcutaneous tissue are involved. So in sometimes there is a destroying of the nerve cells. Okay, so you may get the question like, which category of the burns are involved nerves? Okay, so that is third degree burns. So the next one is the rule of 9. So this rule of 9 is used to assess the burns. So in this rule of 9, for adults 4.5% is the head. Okay, so back of the chest is 18%, and limbs, okay, upper limbs are 4.5%, and in the lower limbs we have the 9%. Okay, 9%. So for the head 4.5%, for the both limbs are, single limb is 4.5, and back of the chest or front of the chest are 18%, remaining lower limbs are 9%. So here perineal area, that is nothing but genital area, it is 1%. So this is for the adult. Okay, so the next one is the children. So in the case of children, everything is normal, but only lower limbs are involved 13.5%, that is nothing but legs. Okay, and upper limbs are 9%, but in the case of adults we have the 4.5%, and lower limbs are 9%. So in the case of child we have the lower limbs are 13.5%, and upper limbs are 9%. So this assessment is known as the rule of 9. So the next one is a Brook and Parkland. So Brook and Parkland formula. So this formula we can use for the fluid calculation. So fluid calculation in the burns patient. So in the case of burn patient, we can use the Brook and Parkland formula. So the next one is the butterfly rash. Butterfly rash. So in which condition we can see butterfly rash? That is systemic lupus erythematosus. Systemic lupus erythematosus. So in this condition we can see the butterfly rash. So what is the meaning of systemic lupus erythematosus? So it is nothing but it is a immune deficiency, okay, otherwise autoimmune disease, okay, autoimmune disease. So in this mainly involved parts are joints, skin and kidneys and blood cells, brain, heart and lungs. So this is the autoimmune disease, that is systemic lupus erythematosus, and in this condition we can see the butterfly rash. So the next one is a flail chest. Flail chest. So in which condition we can see flail chest? That is multiple rib fractures. Okay, so in the case of multiple rib fractures, it is more than the 2 or 3, we can see flail chest. So the next one is a hemothorax. So hemothorax is nothing but blood accumulation in the intrapleural space. Blood in intrapleural space, that is hemothorax. So pneumothorax. So pneumothorax is the air. So the next one is the Mantoux test. So this Mantoux test used to diagnose the tuberculosis, that is nothing but TB. So the next one is the surfactant. Surfactant. So what is the use of surfactant? So it will prevent the collapse. Prevent the collapse of the lungs. So it is a kind of lipoprotein. Okay, see what it will happen, the surface tension will be lowers. Okay, it will reduce the surface tension of the internal lung structure, that is alveoli. So the purpose of surfactant is to prevent the collapse of the alveoli, and it will reduce the surface tension. Okay, so this is surfactant. And the next one is the next important point is chain strokes respiration. So in which condition we can see chain stroke respiration? So in the case of chronic pulmonary disease, so we can see the chain stroke respiration. What will happen? It is progressively deeper. Okay, so the respiration will be deeper and it will reduce, and sometimes it is faster, and at the moment it will be absent, that is dyspnea. Okay, so it will be deeper and upper and lower, I mean increasing and decreasing, and finally presence of apnea. Okay, finally the presence of apnea, it is known as the chain stroke respiration. So mostly we will see in the COPD. So the next one is a deep vein thrombosis. thrombosis. So deep vein thrombosis is nothing but clot formation. So clot formation in the deep veins. Okay, so this is the what is the risk for the deep vein thrombosis? That is air embolism. So this is a big complication of the deep vein thrombosis, that is air embolism, and it may risk increased by the when the emboli is stagnant in the lungs. So when it is stagnant in the lungs, it will lead to the severe respiratory distress. So the next point is heart. So what is the weight of heart? It is average 300 grams. So the layers of heart is, first one is the pericardium, myocardium and endocardium. Again in the pericardium we have the two types, fibrous pericardium and parietal pericardium. Parietal pericardium. And the next one is the myocardium and endocardium. So cardiac fluid is present between the pericardium and myocardium. So when the fluid increases, it is known as the pericardial effusion. So that is pericardial effusion. When it is increased, we can see the cardiac tamponade. So cardiac tamponade is associated with the pericardial effusion. So the next one is chambers of the heart. Okay, so this is the heart. We have the 4 chambers. So first one is the right atrium, left atrium, right ventricle and left ventricle. So in the right side of the heart consists of pulmonary wall and tricuspid wall. So tricuspid wall is present between the right atrium and right ventricle. The blood is coming from the right atrium to the left ventricle by the tricuspid. And the next one is the left side, we have the mitral wall. Okay, mitral wall and aortic wall. So mitral wall is present between the left atrium and left ventricle. So the next one is the apex beat. Okay, apex heart sound we can hear by the stethoscope at the 5th intercostal space. So what is intercostal? The space between the 2 ribs. Okay, so this may be the rib. So the space which is present between the 2 ribs, it is known as the intercostal space. So at the 5th intercostal space, we can hear the apex heartbeat. So the next one is the conducting system. Conducting system of heart. Okay, so mainly conducting system, it is nothing but electrical impulses generating and spreading. So what is the purpose of this conducting system? To beat, otherwise rhythms. So mainly these impulses are start at the sinoatrial node. Okay, at the sinoatrial node. So it is located at the right atrium, superior part of the right atrium. So this is sinoatrial node. So what will happen? It will goes to the atrioventricular node. So this node is present between the atrium and ventricle. So this impulses coming to the atrioventricular node, as well as it will spread over the left atrium even. Okay, and when it is reached to the atrioventricular node, what will happen? The impulses goes to the bundle of His. So two waves are generated from the atrioventricular node. These are called bundle of His. So after that, it will goes to the impulses will goes to the Purkinje fibers. So like that, the impulses will be spread all over the heart. So next one is the blood vessels. So artery and vein. So artery is nothing but the blood vessel which generate from the heart to body. Okay. Vein is nothing but it will from body to heart. So the artery consists of 3 layers. So what is the largest, the thickest layer of the artery is tunica media. Tunica media, which is middle layer of the blood vessel. So inner layer, middle layer and outer layer. So next one is the vein. So vein is from the body to heart. So it also has the thickest layer, that is nothing but tunica adventitia. So this is the thickest layer of the vein, and the tunica media is the thickest layer of the artery. So next we will see various hemodynamic parameters, that is nothing but pressures, blood pressure, types of blood pressure. So first one is a central venous pressure, that is vena cava. So vena cava has the 2 to 6 mm of Hg. So the next one is the jugular venous pressure. Only important points I am taking. Jugular venous pressure. So it is about 6 to 8 centimeters of H2O water. And the next one is the portal vein pressure. Portal vein pressure, that is 8 to 12 mm of Hg. So the next one is the arterial O2 saturation, partial O2 saturation, that is 100 mm of Hg. So the next one is arterial oxygen saturation, that is arterial oxygen saturation, that is about 95 to 100%, and in the veins 70% of oxygen saturation will be present. And the next one is the cardiac output is 4 to 8 liters. Okay, 4 to 8 liters are the normal cardiac output. So next important thing is the cardiac markers. So mainly cardiac markers are myoglobin, and next troponin and CKMB. So these are the markers are elevated in the case of myocardial infarction. So it has the some timing, that is myoglobin within 1 to 4 hours, troponin T is about 4 to 6 hours, and finally CKMB is 4 to 8 hours. So next one is aortic aneurysm. So what is aortic aneurysm? So it is nothing but a bump like structure we can observe on the aorta. Okay, so it is like a bump which is produced or generate from the aorta. Okay, wall of the aorta. So it is known as aortic aneurysm. So if it is present in the brain, okay, if it is present in the brain for the arteries, when it is ruptured, so it will lead to the bleeding. So bleeding in the brain, that is nothing but internal bleeding. So that is aortic aneurysm. The next thing is the aortic stenosis. So in aortic stenosis, the blood vessels will become narrow. Okay, so the diameter of the artery is decreased. So this is known as aortic stenosis. So the next one is the cor pulmonale. So what is the meaning of cor pulmonale? So it is nothing but dilation or increases the or hypertrophy of the right ventricle. Okay, so due to the pulmonary hypertension. So due to the pulmonary hypertension, hypertrophy of the right ventricle, so it will leads to the ventricular overload. Okay, so ventricular overload, so it is known as the cor pulmonale. So cor pulmonale is nothing but hypertrophy of the right ventricle due to the increased pulmonary hypertension. That is so that is known as cor pulmonale. So the next one is the Dukas criteria. So what is the meaning of Dukas criteria? So it is used to assess the pericarditis. Pericarditis. To assess the pericarditis, we can use the Duke criteria. So next one is the boot-shaped heart. So in which condition we can see boot-shaped heart? That is congenital heart disorders. That is tetralogy of Fallot. Okay, tetralogy of Fallot, we can see boot-shaped heart of congenital heart disorders. So the next one is the digitalis. So what is digitalis? It is nothing but it will increases the cardiac function. Okay, so it will increase the cardiac function. I mean, contractions of the myocardium will be taking place by the help of digitalis. So artificially we can give the drugs. Okay, so digitalic drugs are which will increase the heart rate. So the next point is the digoxin drug. So this digoxin drug is used for the cardiac pumping action. I mean heartbeat. So for the purpose of heartbeat, we can use the digoxin, and it is contraindicated in the case of less than 60 beats. Okay, less than 60 beats. When the person having the less than 60 beats, we should not give the digoxin drug. So this is important point, keep in mind. So these are the some of the important points. Okay, thank you guys for watching my video.